Hi, Divya. Uh,
Hi, Manju.
Divya is a very dear friend and ex-colleague from the Asian Development Bank. And I'm really grateful to you, Divya, for sharing this health story with you. I think it's affecting a lot of us, and learning anything about it will be really a bonus. So over to you, Divya.
Thanks, Manju, and thank you for inviting me. And I am congratulations on this initiative. I think it's really really important. I'm here today to talk about colorectal cancer. This impacted my family very deeply, and my sister, who was 43 at the time, was diagnosed with stage 4 colorectal cancer out of the blue. We're based in New York, and it was a trip to the emergency room, and the doctors made her wait for 7 hours because she was young and it wasn't didn't seem like an emergency. And we went in and did a lot of tests, and turned out she had stage 4 cancer. At the time, it just felt really unreal because she was a very healthy individual. Just by way of background, she was an art dealer and a tango dancer and full of life, and really didn't have a lot of health issues, thankfully, for most of her life. And in February of 2021, she started having a bit of like stomach issues, uh, um, bloating, pain in the stomach, to pencil like stool, blood in the stool. She went to a gastroenterologist. They kind of dismissed it as it's a travel bug. It's probably IBS because she was traveling to places for work and personal reasons, and they just thought it was IBS, because of her age, because she was 44 at the time. I think she went back in again, and they had suggested getting colonoscopy. In the US, the age, it's been lowered to 45 now, but she was 44 at the time. But of course, we were in the height of the pandemic, and the wait list to get a colonoscopy was just endless. And it was one weekend at the end of June in 2021 that she just was vomiting and couldn't keep her anything in, water, food. And my mom, who's based in Bangalore, suggested that she go to the ER. And we again thought it was a travel bug. So it turned out to be stage 4 cancer. And soon after, there was a CNN article saying it's now an epidemic, especially for Asians. That it's unexplained how it just suddenly became stage 4. But one of the doctors felt that what's happening, especially for Asians in Western states, is that we're adopting Western diets, and that's not natural for our bodies. So alcohol, red meat, all of that. And maybe there's some sort of link to how stress and diet plays a role in that. I know I was talking a lot, but maybe I'll stop there, in just in terms of like how we got here, and I can then
Yeah,
talk about
thank you
what.
for sharing that, Divya. I think these are common symptoms that one has at any age in terms of bad stomach, or once in a while, if you've got a stomach bug, you might vomit and things. So, what was it actually? Uh, what are the symptoms you think later on, especially when she was treated? What are the symptoms that we should keep in mind because of which we should go through colonoscopy or other similar tests so that we don't miss anything out? And if there was a possibility of catching it earlier, what are the two three things that you think might be useful to know?
Yeah, I mean, one is, I think, so the symptoms that really got, uh, hindsight, we should have paid more attention, was the pencil like stool. And that's because the main tumor was in her rectum, and that prevented natural um,
Yeah,
bowel
natural
movements.
passing out. Yeah.
But also the bloating and not keeping food in. again can be masked as something just as a stomach bug or a travel bug. Um, I think with COVID, we all sort of ignored our health in a lot of ways. We didn't go for annual checkups, which maybe this should have showed in the blood. Um, but just being on top of your checkups, I mean, again, like in the US, it's a tall ask to get a colonoscopy when you're below the age that mandates it, and that's something that I hope there's more awareness for, and not to ignore younger people getting colorectal cancer.
Yeah. So I think, in a way, what you're suggesting is that the test, colonoscopy, should be really done 40 plus age for everybody in a way. And another thing is, if you, as the I've suffered myself, I had an eye problem, and there's a long waiting list for any kind of specialist. I think the other thing would be that if you're traveling, if you're coming to India or some other place where there is a possibility of doing it, give it priority and have this test.
Definitely,
Yeah.
definitely. I mean, she was in Pakistan. I remembered her telling me, and went to a doctor, and they were like, "Something's not right. You got to go check." They saw something in her liver, and she came back. But life takes over, right? And
Mhm.
again, like when you're 44 and living your best life, you don't think you're gonna have like stage 4 cancer. So, I think younger people need to pay attention to their health, and it's a very we've learned firsthand a different journey with younger people, because you question everything, right? And like um, maybe another day, or now we can just in terms of just her treatment and deciding what to do. She was challenging everything and questioning, and I think doctors need to be more sensitive to that, and like the mindset of, I would say, just
Yeah.
people getting terminal illnesses
Yeah.
younger.
Just one last thing. You mentioned about the diet, right? That the Asians, we are adopting diets which are probably not, close to us. Were you suggesting in a way that um, we need to be careful about our diet and maybe not have red meat, processed food? Because frankly speaking, when I think how so many people close to us are getting cancer, and many more are getting it, one fails to put one's finger on any one particular thing.
Yeah.
So I'm not sure if the doctors did they say anything about the reasons why it could have happened.
Yeah. I mean, I think there's not, first, this was an anecdotal, not a scientific,
Yeah,
assessment, but again, like they're just suspicion. Why is it that Asians, I think they were saying by 2050 it'll be the number one cancer. But what is it about it that spiking rates, and they suspect it's diet, and I think it's also the lifestyle. We all lead a very stressful, want it all lifestyle, and just thinking about what that does to your health. And she was very active,
yeah,
and so it wasn't lack of exercise or things, but I do think like it's just stress, and like we live a fast life and eat whatever we can get on
yeah,
the go, and so just being more mindful of that will also help. This wasn't genetic.
yeah.
We did genetic testing, and it wasn't genetic. So you are having cancers that are non-genetic and hereditary, that are spiking.
Yeah. So any last words? Thank you. Really, I really appreciate your sharing this. I know you going through the pain as you talk, but really, thanks a lot for sharing this story and giving us a very clear, guidance in terms of the young people caring about their health.
Yeah, thank you, Manju. And again, this was so important. I mean, that what you're doing, because I keep telling friends, I wish we had a roadmap to navigate what to do and how this impacts families and not just the patient. My sister never wanted to be a cancer patient until her last day, was very determined that she was going to live her life full. And so just to say that, with science, there's a lot of advanced treatments, and just sort of just be on top of your health, like get annual checkups, listen to your gut. If something doesn't feel right, keep insisting. don't don't be dismissed because somebody says, oh, like that doesn't happen at your age. I just think like keep pushing, and listening to your gut is important.
Yeah. Thank you. Thank you once
Thank you,
again.
Manju.
Bye.